I've been with PAF for 18 years. It was founded 22 years ago by Nancy Davenport Ennis. She was the founder and CEO. We assist patients with any chronic, life-threatening or debilitating disease, and that would include diabetes, cardiac conditions, pediatric anomalies, cancers of all different types, stroke, HIV/AIDS. We serve a myriad of issues because the practical barriers that we help with are universal regardless of the type of disease that you're dealing with. When you look at the breakout, we serve everyone from commercially insured to those with TRICARE and government benefits, Medicare, Medicaid, and the uninsured.
I get the privilege of working with patients, helping them with access to care, help with their insurance premiums. A lot of times they want assistance with pharmaceutical copays, so we help find those resources that they need.
I think if we would have been connected with a Patient Advocate Foundation, it would have taken a huge toll, even more so of a toll on our personal lives and just the stress that comes along with dealing with surgery, because you're in a situation where you're already dealing with a surgery, you're already dealing with rehabilitation and all these things, and then to add to that, you're trying to sift through all this financial stuff that doesn't make sense anyways. And so it was already hard. If we hadn't had Patient Advocate Foundation, it would have just multiplied the difficulty 10 times over.
I think the most important thing that we do here is we help people realize that they're not alone, that they're not going through this just all by themselves, that there are people that can help them either financially or with education that can explain maybe the tough things they deal with insurance or pharmacies, or just simple things like how to talk to your doctor.
I just think that more of the community needs to know about the Patient Advocate Foundation and what they do, because they can definitely help, and you know, people in that situation shouldn't feel like they're alone.
Everybody thinks that when you get sick, your insurance is going to cover everything, and we know that's not true.
And sometimes when you're talking to patients who are on a limited or fixed income, it kind of comes, do I get it or do I not? And then having that hard decision, do I go with a profound therapy or do I go with a regular standard therapy that my doctor is suggesting here? And so you're kind of thinking, should there be a price on life? So then it kind of comes in where our expertise, our case management services help to do the more appeals part to the insurance company, giving them the data, giving them the information they need, and actually getting the insurances to change their mind and the view, and getting the test approved for the patient.
The biggest benefit that patients get from their interactions with case managers here at the Patient Advocate Foundation, we give them hope. When there's sometimes when they don't see a way out and they don't have any hope. If they can get that small glimmer of hope, then they can start moving forward. Many times when patients call, they're at the end of the rope. They don't know what to do. And we let them know. I let the patients know, me personally, concentrate on getting better first. And you let us worry about those bills. We'll work with you on the bills, one bill at a time. And you just concentrate on getting better.